Thank you, Mark. Tonight in medical rounds, doctors at Hartford Hospital recently implanted the world's smallest pacemaker. It's called the micro-transcatheter pacing system, and it's designed for patients who need a single-chamber pacemaker. Joining us live to talk more about it is Dr. Zweibel. He is the Director of Electrophysiology at Hartford Hospital. Good evening, Dr. Zweibel. Good to see you again.
Good evening, Denise.
This is certainly pretty novel, and the size is more like, I understand, a vitamin capsule, which is pretty remarkable. How does this work? How is it implanted?
Well, Denise, what we do is we place this catheter, the micro-transcatheter pacing system, through a vein in the leg up inside the heart. We use a delivery system through that catheter. We place this pacemaker into the lower right chamber of the heart, the right ventricle. There are small metal tines on the device that keep it in place in the ventricle. Once we have it in place, we cut a small little tether that holds it to the delivery system, and we pull everything out of the body, leaving the pacemaker behind to work. Procedure takes about 45 minutes to an hour.
Wow, we're watching the animation of how it works as you were describing it. It looks amazing. What are the benefits of this particular pacemaker when you compare it to the more traditional ones?
Well, unlike a traditional pacemaker, the micro-pacing system has no leads or wires that go into the veins and into the heart, so complications such as fracture of these leads or dislodgement are basically eliminated with this pacemaker. Also, there's no incision in the chest like a routine pacemaker. The device is MRI compatible like most traditional pacemakers. The battery lasts about 12 years.
Wow.
The device also has the ability to increase a patient's heart rate for them when they exert themselves.
Wow, there's a lot of pluses there. We have a few seconds left, but I want to ask for our viewers who might be interested, what type of patient, who would be an ideal candidate for this type of pacemaker?
Sure. Patients who are candidates for this typically are patients who require a single-chamber pacemaker in the lower chamber of the heart, or patients who can't really receive a traditional pacemaker. Now, typically a patient's cardiologist or electrophysiologist will let them know which pacemaker system is best for them.
All right. Thank you so much, Dr. Zweibel, for sharing this new device with our viewers. The technology is absolutely amazing. If you'd like to learn more, you can call the number you see on the screen there. In the meantime, if you have a question for Dr. Zweibel, you can join a live Facebook discussion on the Hartford Hospital Facebook page in just a little bit at 6 o'clock.